It's been well over a year since COVID-19 was detected in Minnesota. Although we know a lot more about the virus than we did last year, and many have gotten their vaccinations, there's still a lot of information to track as the Delta variant surges across the state and the country. So we're asking an expert, Dr. George Morris, some questions during this stage of the pandemic. How contagious is the Delta variant?
The Delta variant is, you could call it tougher, stronger, harsher, or spreads more. And the challenge is that this Delta one does all three of those. We had what you'd call traditional COVID, then there was an Alpha variant, a Beta variant, and now Delta. And that one is twice as powerful or twice as contagious as the Alpha one, which was twice as contagious as the original. So now we're up to, 4 times as contagious as the first one. With that, it means that one person can probably spread to 6 or 8 people, not just, 1-to-1 or 1-to-2, so it spreads easier.
How has Delta impacted hospitalizations?
We have to think of COVID in the waves that we've had. We had the initial wave, we had the fall wave, kind of November, December, that was really long and hard and harsh. During that one, we probably had about 25% that were ICU. In the spring wave, kind of that March, April, we were up about 1/3 patients were ICU. And if what we're seeing now is, 40 to 50% of our patients are in the intensive care unit with COVID, and that's keeping our facilities busy.
Will vaccinated people need booster shots in the future?
The FDA is still looking at the booster data, and that'll be 2 things. One, is it a timing of when you need the booster, whether it's 9 months, 12 months after your first shot, or which subgroups, which populations may need it. And that's probably where I think that things may lean initially, is people that are immunocompromised, are on chronic medications that suppress their immune system, or that are really elderly. That's probably where we're gonna be focusing a lot of our efforts for the boosters. But remember, the benefit of the boosters is to give extra protection to the people that are vaccinated. We really still wanna have a push and a focus on the people that haven't even received their one vaccine yet. Let's get everybody onto this team, in the same boat, pulling together so that we can kind of beat this.
What should people do to protect themselves from the variant?
I would maybe try to think about it in layers, kind of simple, but 3 layers. Number 1 is our behavior. Decrease your risk social activities, try and come back a little bit together, smaller groups, kind of safe spaces outdoors. And the next would be, the vaccine. That's a great layer of protection. But if those aren't working, you need to add the masks as that 3rd layer of protection to kind of help make it better for yourself. And remember, part of this is so that we're all in this together. If I can wear my mask, it protects me and it protects you.